Hello, everyone. It is Tuesday, October 13th. Welcome to another episode of Together San Diego. I'm your host, Luis Cruz, Community Relations Director for the San Diego Union-Tribune. Since 1971, North County Health Services has been the community health and wellness partner who has served people regardless of their income or ability to pay. The health services provider recently changed its name to TrueCare. Take a look.
Hello, welcome to TrueCare. Here, everyone is welcomed. Here, we're committed to high quality and coordinated care. Here, we're building lifelong relationships with every patient. In short, we're here for you and your family. Our world-class team of compassionate doctors and care professionals have dedicated themselves to helping you in every step of your healthcare journey. So connect with us. Give us a call or text. Follow us on social media or drop by anytime to schedule a visit with your new healthcare team. TrueCare. Health inside. Welcome in.
Joining me this afternoon is Michelle Gonzalez, President and CEO of TrueCare, and Dr. Marie Russell, Chief Medical Officer at TrueCare. Thank you both for joining me today.
Thank you, Luis.
Thank you so much for having us.
It's my pleasure. Michelle, tell us a little bit more about TrueCare, your mission, and why the name change.
Sure. So, we have actually been in existence for close to 50 years. As you mentioned, we are a family of 12 health centers located throughout North San Diego County as well as Riverside County. And our mission is really to improve the health status of our diverse communities. We are a federally qualified health center, also known as a community health center or community health clinic. And we serve annually about 67,000 patients with more than 300,000 visits. We have, as you would imagine, an outstanding workforce, amazing world-class physicians and providers. And our footprint in San Diego County actually spans about 42 miles. So we're in one of the most rural areas in Ramona, all the way out to the coast in Encinitas. And recently we did go through a name change. So we were formerly known as North County Health Services, and most recently, just last month, actually adopted TrueCare. And there were really three primary reasons for that. The first is we talked about we're no longer limited to just North San Diego County. We're actually in Riverside County now. We have a clinic that's there in Paris. In addition, we are not a county entity. We love the county. We appreciate all of the work that they do. We're great partners with them and really embrace the opportunity to collaborate. But we recognize that that was a point of confusion for many of our patients. And so we wanted to remove that. And then the third is, we really wanted to take an opportunity to renew our promise to the community and to the patients that we serve. And it's so relevant, Luis, especially now in light of the pandemic. Now more than ever, folks need to know what resources are available to them. They need to know where they can turn to for healthcare. And so we're so excited to have the opportunity to make sure that our existing patients, as well as potentially new patients, know that we're available for them.
Yeah, I was going to ask you, what challenges are you seeing today, specifically with lower income families and their health, and during this time of COVID?
It's been such a devastating time on so many levels for so many individuals. Our patient population primarily tends to be those who are either underinsured or uninsured. And, in light of COVID, we're seeing now more than ever an increase in the number of individuals who are lacking insurance. Unemployment is at an all-time high. As we all know, businesses are closing. Individuals' living situations have been impacted. They're having to, move away from the comforts of home that they once realized and potentially move in with other family members. And in addition to all of that, they're also neglecting their health. A large portion of our patients actually have chronic care issues, and so they need ongoing care and maintenance. And so again, we want to make sure that, despite the pandemic, they know what is available to them. And they know that they can access care and services, because what we're watching play out right before us is this continued disparity continue to emerge with regard to the inequities of health, right? And we're seeing that now more than ever, especially with those who are struggling financially.
Yeah. Dr. Russell, what healthcare trends are you seeing right now, and what concerns do you have?
Yeah, well, certainly, I think first and foremost on all of our minds is that we're just living through a very stressful time. The pandemic has created circumstances in all of our lives, in our patients' lives, in our communities that are just unprecedented. And so we're trying to figure out how to best serve those communities. And so, first and foremost, the stress and the anxiety that people are experiencing, the exacerbations of underlying mental health issues, the challenges that exist of folks that have chronic medical problems, as Michelle said, but also acute problems. And how do you manage that? How do you take care of both those chronic medical problems and the acute problems? TrueCare really prides itself on being a patient-centered medical home. And what does that mean? That means putting the patient first at all times and the ability to have patients get the care when they want, where they want, and how they want. As we said, as we heard the history of TrueCare in North County Health Services and Health Project, we've been in the community for many, many years. We recently had a gentleman who had been with us for the past 5 years who had struggles with alcohol use disorder and alcohol addiction, but had been clean and sober for many, many years. And the stress of this pandemic that we're all feeling really affected him, and he slipped. But he felt that he could trust TrueCare. He felt that he had that relationship that is so important to the ability to deliver healthcare, that he was able to reach out, and we were able to support him both through in order to prevent withdrawal from alcohol, as well as get him into ongoing treatment. And we have the modalities in which we're able to do that both in person and via telehealth or virtual health. So we can meet patients where they are and want to make sure that we're supporting them as they need to be supported.
Can you talk about some of the healthcare services that TrueCare provides?
Sure. So as I said, TrueCare is a patient-centered medical home, but we offer a variety of what I would refer to as primary care services. So we have adult medicine and pediatrics. We have family practice. We do offer behavioral health. As a patient-centered medical home, we have actually integrated behavioral health into our primary care practice. In times like this, when it is so stressful, we're trying to take care of the person as a whole. So we want to be able to offer that service as much as we can when the patient is within our clinic or virtually within our meetings. We also have dental services, chiropractic services, and then we have our partners in the community where we work to get folks the referrals that they need in order to offer the best care. But we also have a heavy reliance on our community and our outreach. So as Michelle mentioned before, we have the ability to assist our patients in getting insurance or how they can navigate that. Our outreach workers are both able to identify what the community is needing, but also bring some services out into the community. And so we try to take a look at what the needs of the community are from a population health standpoint, from a social determinants of health standpoint, and make sure that the care that we're individually providing is provided in that context.
Yeah. Michelle, I understand many people are missing out on healthcare services. Talk about that and who you provide healthcare for.
Sure. So, I think one of the primary things to remember is that we provide healthcare to anyone and everyone in need, regardless of your insurance status or your ability to pay. And as Dr. Russell mentioned, we're really keen on and committed to meeting individuals and our patients wherever they're at in their healthcare journey. Healthcare is complicated. It's not necessarily easy to navigate. And so anyone who is in need of either insurance assistance or connectivity to their primary care provider, we would encourage them to come in and see us, check us out on our website, or however, whatever means you're comfortable with in connecting with us. We're absolutely here, ready to meet you where you're at in your healthcare journey, and want to just assure that folks know that we are the safety net. And we're here to care for those who are most vulnerable. And individuals may be finding themselves in a vulnerable situation right now where they maybe were not once before, right? Circumstances are changing. As Dr. Russell mentioned, this pandemic has impacted everyone in a different way. And your circumstances may be very different today than they were 12 months ago, 6 months ago, 3 months ago, and may even be different in the future. And that's one of the primary things is that we want our patients and our communities to be aware of, is that we are really a healthcare leader, and we're here to assist you with whatever your needs might be. It doesn't necessarily mean we'll be the one to render the service directly, but we have great connectivity with so many other community-based organizations, and we want to be your introduction and your first stop. Because as you're finding yourself or your family having to navigate these situations and these challenges, it is intimidating, it is stressful, and it can be scary.
Yeah. Dr. Russell, what steps have you taken to ensure the safety of your patients during the pandemic?
Sure. So, we follow the CDC guidelines and are looking at them actively. We're also following the county guidelines. So all of our employees are screened every day prior to entry of the building, as are our patients. The screening for our patients actually starts online or when they call to make an appointment. And we ask them questions related to either symptoms or potential COVID exposure. Those questions are again asked when they arrive at the facility and their temperature is taken. And those questions are then again asked at the registration. So we're trying to make sure that we're doing our due diligence to make sure that we are keeping patients safe. We certainly have heightened our cleaning and our infection control practices and have increased cleaning of external and places of waiting and that sort of thing as well. In addition, we are trying to make sure that if folks are sick, that we are able to take care of them. And we're doing that through the ability to refer them for a virtual health visit and also for testing if they need it.
Where can the public go to for COVID testing?
Yeah, so we offer COVID testing at TrueCare at 3 locations. So we offer it at San Marcos, at Loma Alta, location in Oceanside, and also at our Ramona clinic. In addition to that, we have lists that we can provide folks if they're unable to make it during our hours of operation, where they can get tested at our county or our community partners.
Great. Now, I understand you could also make virtual health appointments. Talk about that if people can't come into your community health centers in person.
Yeah, so we have the ability to see folks and take care of them, as we said, either in person or via virtual health, via video or telephone. And so when an individual calls to make an appointment, depending upon what they're calling for, they may either be offered an in-person visit or a telehealth visit. Again, we want to also respect the patients and what they're comfortable for. So if a patient is still not comfortable coming into our facility despite the efforts that we're taking to keep people safe, we want to make sure we're taking good care of them. So we do have the option for them to have a provider visit via either telephone or video. Our virtual health program also extends past that. We talked a little bit about holistic care and the primary care services that we offer here, but we're also able to offer consultative services where we have the ability to consult with specialty providers and get that information back, thus eliminating potentially the patient from having to go out to yet another visit as well. So we're really dedicated and committed to working with the patients to make sure that we're getting the care that they need in the way that they want it.
And along those lines, where can people go to for a wellness check and care for chronic conditions like diabetes and breast cancer screenings?
Yeah. So again, we have the ability to deliver a lot of those services either in person or via our virtual health. Clearly, there's some things that we know that we want folks to be getting, like pap smears and mammograms, that we're not able to do virtually. But we work with the patients to make sure that if they are needing those services, that they are able to obtain them in person in a safe manner. We do offer mobile mammography services here, and we've started that back up so folks folks can come on in and get scheduled to have mammograms. We're currently, our women's health team is ready and prepared, as is our family medicine team, to provide chronic care and pap smears and other women's health related wellness. And then our other chronic diseases such as diabetes and asthma and COPD, we work with the primary care providers and the patients to make sure that that care is delivered in a way that is appropriate for both the patient and their disease process.
Right. Michelle, you've been at TrueCare for 20 years. What convinced you to stay at TrueCare and support the community?
Well, first I would say that it is an absolute honor and privilege to continue to be a part of our phenomenal organization, TrueCare. There's really two primary things that keep me coming back. And the first are the individuals who I have the great opportunity to work with, both directly within TrueCare and also those who are affiliated with us in the community as a partner. And then the other, obviously, is the strong connection that I have both personally and professionally with the mission of TrueCare. The two are so aligned and really speak to my heart in a variety of ways. And it actually reminds me of a patient story. I'll share with you, several years ago, we had a patient who fled a domestic violence situation, and she had actually 3 small children who she had in tow with her. And she arrived at our health center here in San Marcos and was really in just a world of hurt and had, a ton of distress that she was working through and didn't really have anyone to turn to, had very limited family. And so we were able to connect her with a variety of resources, diapers, formula, clothes for herself and for her children. We pulled in other community-based organizations, and it was really the community wrapping themselves around her and her children. We also got her connected with job placement, and several months later, she came back to see myself and the staff, and she actually presented us with some flowers and some tamales. And anyone who's ever had tamales or who's had the opportunity to make them knows what a labor of love it is and how much goes into that. And I think that that's such an expression and really sort of epitomizes what we're all about, is this labor of love and this strong connectivity. And so, yes, we're on the forefront of providing healthcare services, and certainly in the face of a pandemic. But one of the things that we pride ourselves on is that our patients are a direct reflection of our staff, and our staff are a direct reflection of our patients. And we embrace the opportunity to not only provide healthcare services, but to invest in the whole person and really to address their healthcare needs and their needs, both individually and as a family, because we recognize that by investing in them, we're investing in our communities, and ultimately and collectively, we're investing in society. We believe very strongly, and I do personally, that healthcare knows no boundaries. It's something that should be accessible to everyone. And that really is a huge part of what we do and a huge part of what keeps me both connected to TrueCare professionally and personally. It speaks to everything that I stand for.
Yeah. Well, we appreciate everything that you and your team are doing to help the community, especially during this time. Is there anything else that either of you would like to add?
I would just encourage people to please reach out to us. As Dr. Russell and myself mentioned, your healthcare needs are so important. And I think now more than ever, folks need to be inspired. They need a reminder. They need a source of hope. And we can provide that and be that for you. Each of these individuals, all of our patients are valued, and your life matters. And we want to assist you and help you be your best. And do whatever we can, regardless of what your needs are and or your ability to pay. We're very much committed to our communities and to our staff, and it's such a huge honor and privilege to do the work that we do. So, again, please reach out to us via the internet and or give us a call. If you do give us a call, I will just tell you I apologize in advance if you have a long wait time. We've had an outpouring of calls. So bear with us, and I just ask for patience and grace in advance.
Sure. Dr. Russell, anything else you'd like to add?
Yeah, no, I would just echo Michelle's sentiments. And again, I think, as a community, we are really all in this together. And we're here to support the community and our patients in any way that we can. And we just want folks to know that we're here for them.
Great. All right. Well, thank you, Michelle Gonzalez, President and CEO of TrueCare, and Dr. Marie Russell, Chief Medical Officer at TrueCare. Thank you so much for joining us.
Thank you, Luis. It was a pleasure. Take care.
Thank you so much. Take care.
Thank you. And thank you at home for watching, everybody. Have a great day.
San Diegans accomplish great things every day. We care about our neighbors and our community. We are proud of our diversity. We are resilient. We hold our leaders accountable. We live in one of the most dynamic cities in America, the San Diego Union-Tribune, telling San Diego's story for more than 150 years.